Did you know that people with diabetes can lose up to 10 times more fluid than those without the condition? This dehydration can lead to serious complications if not managed properly. When we think about diabetes, we often focus on managing blood sugar levels, but today, I want to explore a crucial aspect of diabetes management that's often overlooked: dehydration. The link between diabetes and dehydration is more intertwined than you might think, and understanding this connection is vital for those living with diabetes. In fact, dehydration can exacerbate diabetes symptoms, making it harder to manage blood sugar levels, and even increase the risk of complications like nerve damage, kidney damage, and even heart disease. So, why is dehydration such a common issue for people with diabetes? It's because diabetes can disrupt the body's ability to regulate fluids, leading to a vicious cycle of dehydration. And, if left unchecked, this can have serious consequences. That's why it's essential to understand the connection between diabetes and dehydration, so we can take proactive steps to prevent dehydration and manage our diabetes more effectively. Moving forward, I want to dispel some common misconceptions about hydration in diabetes and highlight the challenges faced by diabetics when it comes to staying hydrated. One common myth is that people with diabetes need to drink more water to stay hydrated, but this isn't entirely true. Yes, drinking water is essential, but it's not the only factor at play. In reality, people with diabetes need to consider their individual hydration needs, which can vary greatly depending on factors like medication, diet, and physical activity. Another misconception is that thirst is an adequate indicator of hydration levels. Unfortunately, this isn't the case for people with diabetes, who may experience nerve damage that affects their ability to feel thirsty. This means that diabetics may not always realize they're dehydrated until it's too late. Diabetes also affects hydration levels because of the way it impacts the kidneys. When the kidneys aren't functioning properly, they can't concentrate urine effectively, leading to a loss of electrolytes and fluids. This means that people with diabetes may need to pay closer attention to their electrolyte intake, not just their water consumption. In addition to these unique challenges, diabetics may face obstacles like limited access to clean drinking water, lack of education about hydration, and even the physical limitations that come with diabetes-related complications. All these factors can increase the risk of dehydration, making it even harder to manage diabetes effectively. Furthermore, certain diabetes medications, like diuretics, can increase urine production, leading to dehydration if not balanced with adequate fluid intake. This highlights the importance of working closely with a healthcare team to develop a personalized plan for managing hydration in diabetes. As we explore the connection between diabetes and dehydration, it's essential to understand the physiological reasons behind increased thirst and the risks of dehydration. Let's dive deeper into this complex issue. When we have diabetes, our body's ability to regulate blood sugar levels is impaired. As a result, our body tries to remove excess glucose through the kidneys, which requires more water. This process is known as osmotic diuresis, and it can lead to a significant loss of fluids and electrolytes. As the body tries to compensate for this fluid loss, it can stimulate the thirst response, making us feel like we need to drink more water. However, this increased thirst can be misleading, as it may not always reflect our true hydration needs. Moreover, the nerve damage caused by diabetes can disrupt the body's natural thirst response, making it harder to recognize when we're dehydrated. This highlights the importance of monitoring hydration levels regularly, rather than relying solely on thirst. Dehydration can also affect our body's ability to absorb insulin, making it harder to manage blood sugar levels. This is because dehydration can lead to a decrease in blood volume, which reduces blood flow to the muscles, making it harder for insulin to be absorbed. Furthermore, dehydration can increase the risk of complications like kidney disease, heart disease, and even blindness. In fact, a study published in the Journal of Clinical Endocrinology and Metabolism found that even mild dehydration can increase the risk of developing kidney disease in people with type 2 diabetes. The risks of dehydration are real, but what if I told you that there's hope? I want to share a personal story that illustrates the critical connection between diabetes and hydration. I remember when I first started managing my diabetes, I was so focused on controlling my blood sugar levels that I neglected my hydration. It wasn't until I started experiencing symptoms like dizziness and fatigue that I realized the importance of staying hydrated. With the help of my healthcare team, I developed a personalized plan that prioritized hydration, and it made all the difference. My experience taught me that staying hydrated isn't just about drinking water, it's about understanding our individual needs, monitoring our hydration levels, and being proactive about managing dehydration. The connection between diabetes and dehydration is complex, but it's not impossible to manage. By understanding the unique challenges diabetics face and taking proactive steps to prioritize hydration, we can reduce the risk of complications and improve our overall health. In conclusion, staying hydrated is crucial for diabetes management. Remember, it's not just about drinking water, it's about understanding our individual needs, monitoring our hydration levels, and being proactive about managing dehydration. Take control of your hydration today, and start seeing the difference it can make in your diabetes management. What are your experiences with diabetes and dehydration? Share your stories or questions in the comments below. And don't forget to check out our related videos on diabetes management for more valuable insights and tips.